Welcome to The Explainer. Today, we're going to take a tour of some of the most critical real estate in your entire body, a place you've probably never even heard of, the mediastinum. Think of it as this busy central corridor that's packed with your most vital organs. And as we're about to see, its unique design is both an absolute marvel and a major vulnerability.
So here's our game plan. First up, we're going to nail down what the mediastinum actually is. Then we'll map out its different neighborhoods, kind of see who lives where. And finally, and this is really the crucial part, we'll unpack why this packed central hub is one of the most vulnerable spots in the human body.
Okay, first things first. What in the world is the mediastinum? You know, to really get why it's so important, we have to be super clear on what it is, and maybe more importantly, what it isn't.
Right. So here's the key thing to wrap your head around. The mediastinum isn't an organ itself, not at all. It's a space, a central compartment that's perfectly nestled right there between your lungs. Seriously, think of it as the body's most valuable piece of real estate, and it's housing some absolutely essential tenants.
And when I say packed, I mean it's packed. We're talking about the heart, all the great blood vessels, your windpipe, your esophagus. They're all crammed in there together. And the whole thing is held in place by this loose connective tissue, which, is great for flexibility. But as we're going to find out, it also creates a massive vulnerability.
So how do you even make sense of such a crowded space? Well, anatomists came up with a kind of floor plan. They've divided the mediastinum into these distinct neighborhoods just to keep everything organized.
And the first division? It's actually really simple. Just imagine a single horizontal line that runs from that little bump on your breastbone, the sternal angle, straight back to your spine. That one line cuts the entire space in two.
And just like that, this one simple line neatly splits the whole mediastinum into two levels. You've got an upper floor, which we call the superior mediastinum, and a lower floor, the inferior mediastinum.
But we can get even more specific. That lower floor, the inferior one, gets subdivided even further by the heart itself. The heart's pericardial sac creates these three distinct zones, a front compartment, a middle one that houses the heart, and a back compartment. Okay, now let's meet the tenants living in each of these compartments. And trust me, knowing who lives where isn't just for passing anatomy quizzes. It's absolutely critical for figuring out what's going wrong when a problem shows up. This is basically a clinical map. Doctors use this who lives where knowledge all the time to narrow down what a problem could be. For instance, a mass you find in the front is likely something very different from a mass you'd find in the back. This anatomical zip code is a huge clue. But this crowded, super-connected design, it's got a serious downside. Yeah, it's efficient, but it also makes this central corridor surprisingly vulnerable. And here's why that is. There are these connective tissue pathways. You can think of them like biological highways that run directly from your neck all the way down into your chest. This creates a direct route for trouble. It means an infection that starts in your neck can easily travel south right into the very heart of your body. Hey, remember that loose connective tissue we talked about that holds everything together? Well, it turns out it's terrible at containing infections. A problem can just spread like wildfire in there, leading to this life-threatening condition called acute mediastinitis. There are almost no firewalls to stop it.
So what causes this terrifying infection? Well, most of the time, it's a tear in the esophagus. It could be from a medical procedure or from swallowing something sharp. Either way, a rip in that central tube can have absolutely devastating consequences. It really shows you just how fragile this whole area is. Infections aren't the only threat, though. What happens when something new, like a tumor, tries to move into this already jam-packed neighborhood? Well, with absolutely no room to expand, it just starts squeezing its neighbors. This leads to a condition we call mediastinal syndrome. And it's not really a single disease, it's more like a collection of symptoms. And what those symptoms are depends entirely on which vital structure is getting compressed. The symptoms that show up are actually incredibly logical. If a mass starts squeezing the trachea, your windpipe, it's going to cause difficulty breathing. Makes sense, right? And if it presses on the esophagus, which is right next door, you get difficulty swallowing. And the effects can be really subtle or incredibly dramatic. Pressure on one tiny little nerve can make your voice hoarse. But pressure on a major blood vessel like the superior vena cava, that can cause really dramatic swelling in the face, the neck, and the arms. So what's the most common culprit behind this dangerous compression? Unfortunately, it's often lung cancer. It can grow or spread right into this central compartment and just wreak havoc on all those vital structures that are packed so tightly inside.
So I think the key takeaway here is this great paradox of the mediastinum. On one hand, its design is a masterpiece of efficiency, packing our most vital systems into one central hub. But on the other hand, that very same design creates a profound vulnerability. It's just a powerful reminder of how interconnected and how truly fragile our bodies really are.
All right, today we're going deep inside the human body to talk about a condition that's as serious as it is, well, frankly, unheard of by most people. Acute mediastinitis. This is a nasty infection that takes root in the central corridor of your chest, right next to your most vital organs. And understanding it, it reveals this fascinating, almost hidden vulnerability in our own anatomy. And let's not beat around the bush about how serious this is. The source material is crystal clear, calling it a life-threatening disorder. That's not a minor infection we're talking about. This is a full-blown medical crisis. That one phrase tells you everything you need to know about why this matters so much. So that really is the central question, isn't it? To get a grip on this, we need to know two things: where this is all happening and how on earth an infection gets into what should be a completely protected space. Let's start with the where. First things first, we've got to talk anatomy. You can't really understand the infection until you understand the space it takes over. And that space is called the mediastinum. So, what is the mediastinum? Well, think of it as the central command center of your chest, basically sandwiched right between your lungs. It's not really an organ itself, it's more of a space. But it's a space that is packed with the body's absolute superstars. You've got the heart, all the major blood vessels, your windpipe, your esophagus, pretty much the whole shebang. It's mission control for your entire torso. What's really interesting, though, is how this space is organized. It's not just one big open area. It's actually split into 3 different compartments: anterior, middle, and posterior. And this little detail is super important because, as we're about to see, where the infection is can give us a huge clue as to why it's there. Okay, so here is the critical twist. Even though it houses our most important organs, the mediastinum itself is shockingly vulnerable. It's filled with this loose, fatty tissue, which means there are basically no firewalls. Nothing to stop an infection. It can just spread like wildfire. And if that wasn't that enough, this space is directly connected to your neck up above and your abdomen down below by these thin sheets of tissue that act like superhighways for infection to travel fast. So we've established the where. It's this vulnerable central hub in our chest, which, of course, leads to the next big question. How does a space that is supposed to be totally sterile get infected in the first place? And this table just lays it out so clearly. You can see how the location points to the cause. If the infection's up front in the anterior compartment, it's probably from cardiac surgery, where they have to open the sternum. If it's in the back, it might have spread from the lungs. But look at that middle compartment. Esophageal perforation. That's the one we really need to zoom in on. Because while an infection can sneak in from a few different places, our source material makes it very clear that one cause stands head and shoulders above the rest. It is, by far, the most frequent offender when it comes to acute mediastinitis. And here it is: esophageal perforation. In plain English, that's a hole or a tear in your esophagus. It's the #1 cause, period. Just think about it. The tube that carries everything from your mouth down to your stomach suddenly springs a leak. All of that stuff, food, saliva, billions of bacteria, spills directly into that vulnerable central corridor we were just talking about. It's a disaster. It sounds so dramatic, right? I mean, the esophagus is a pretty tough, muscular tube. How does it just burst? Well, it turns out the reasons can be pretty varied. Everything from a complication during the medical procedure to a really sudden, violent event. This is a rundown of the common causes. The #1 reason is actually instrumental, meaning an accidental tear during a medical scope, an endoscopy. But it can also happen from swallowing something sharp or from the insane pressure of really severe vomiting. There's even a name for that, Boerhaave syndrome, where the force is so great it literally blows a hole in the esophageal wall. And then you have things like trauma or swallowing caustic chemicals. It's just a whole list of really unfortunate ways this critical tube can fail. So, now let's put all the pieces of the puzzle together. We've looked at this incredibly vulnerable location, and we've seen the most common way it gets infected. When you combine those two things, You get a perfect storm. Really, the big takeaway from all of this boils down to this one simple but incredibly powerful equation. You have a vulnerable central space with absolutely no internal barriers to stop infection. Then, you introduce a direct source of nasty bacteria from a hole in the esophagus. What you get is an immediate, fast-spreading, and all too often fatal medical emergency. It really makes you stop and think, doesn't it? The very same anatomy that's designed to keep us alive also has these hidden trapdoors, these potential weak points. And it leaves us with one last question to chew on. What other hidden vulnerabilities are just lying dormant inside us, waiting for just the right, or maybe I should say the wrong, set of circumstances to become a crisis?
Hey, welcome to our explainer. Today we're going to talk about something pretty wild, a rare condition where your body's own healing process basically goes haywire, right in the middle of your chest. It's called chronic fibrosing mediastinitis. So think about this. What happens when a pretty common infection triggers something, well, uncommon and actually really dangerous, right in the center of your chest? It's a heck of a question, right? And today, that's exactly what we're going to break down. We'll look at how this whole chain reaction gets started. Okay, but before we dive into the disease itself, we've got to talk about where it happens. Get our bearings. We need to understand this very specific part of the body where it all goes down, the mediastinum.
So, what is the mediastinum? Well, it's basically the central compartment of your chest. It's not really an organ, it's more of a space, kind of sandwiched right there between your lungs. A good way to think of it is like the bustling downtown of your chest, bordered by your sternum, your spine, and all this bone and muscle.
And this space, it is packed with super important stuff. We're talking about your heart, all the big blood vessels, your trachea, that's your windpipe, and your esophagus. It's like the grand central station for your body's most vital functions. So, and this is the key takeaway here, anything that goes wrong in this tiny area, well, it has the potential to mess with a lot of really critical systems. All right, so now we know the where. Let's get to the what. This brings us to the condition itself, and it's all about a process called fibrosis.
And just a quick heads up before we go any further. You might also hear this called granulomatous mediastinitis. Don't let it confuse you, it's the exact same thing, just a different name. So, same process.
Let's actually break down that name, chronic fibrosing mediastinitis. Mediastinitis, that just means inflammation of the mediastinum, the space we just talked about. And fibrosing, that refers to fibrosis, which is basically the body forming way too much scar tissue. So put it all together, and you've got a condition where a ton of scar tissue builds up in that central chest cavity. And it's all triggered by a mass of dead lymph nodes.
Okay, so that naturally leads to the next big question, right? What makes these lymph nodes just die and set off such a crazy reaction from the body? Because this doesn't just happen out of nowhere. There's a very specific trigger.
So, what is it that sparks this whole dramatic chain reaction? What's really wild is that the culprits are usually microorganisms that tons of people are exposed to all the time. But for some reason, only a very, very small number of people end up with this severe complication.
The main triggers are infections. The big one is a fungus called Histoplasma capsulatum. You find this thing in soil, especially soil with bird or bat droppings. Another major cause is the bacteria that causes tuberculosis, Mycobacterium tuberculosis. And then there are a few other related fungi and mycobacteria that can kick it off too.
Okay, so now let's connect the dots. How does a simple infection turn into such a massive physical problem? This is really the heart of it all, the step-by-step journey from a tiny little invader to this big, troublesome mass.
It really happens in about 4 key stages. So, step 1, the infection happens. Step 2, in response, the lymph nodes in your mediastinum go to work fighting it off. But in the process, they actually die. They become necrotic. Step 3, and here's where it gets weird. These dead lymph nodes don't get cleared away like they should. Instead, they start clumping together, merging into one single large mass. And then, step 4, the final crucial piece. That mass just sits there, acting like a constant irritant, and the body's response is to throw an intense, totally out-of-control scarring or fibrotic response at it.
So what you end up with is this growing mass of hard, stiff scar tissue. And here's the thing. The problem isn't the mass itself. It's what that mass does to everything packed in around it. This is why the condition is so dangerous. It all comes down to one word: compression.
Yeah, the consequences are all about that squeezing. Remember all that vital stuff we said was packed in the mediastinum? Well, when this fibrotic mass grows, it can start to squeeze your trachea, making it hard to breathe. If it pushes on your esophagus, suddenly it's hard to swallow. And if it constricts the superior vena cava, that's the huge vein bringing blood back from your upper body, you can get facial swelling and veins popping out. The symptoms you get depend entirely on what's getting squeezed.
And that leaves us with this really fascinating, kind of mind-bending paradox, doesn't it? I mean, fibrosis, making scar tissue, that's supposed to be a healing process. It's how the body patches things up. But in this case, that very process becomes the weapon. And it really makes you wonder, how can a fundamental tool for repair turn into something so destructive? Understanding a rare condition like this isn't just about this one disease. It really gives us a window into all sorts of other conditions where the body's own healing response is what ends up causing the harm. It's just a powerful reminder of the incredibly delicate and sometimes dangerous balance happening inside us all the time.
All right, today we are diving into a medical condition with a real mouthful of a name, pneumomediastinum. Now, it sounds super complicated, I know, but the idea behind it is actually pretty straightforward. We're talking about air getting trapped literally in the very center of your chest. We're going to unpack how this even happens and why the body's central highway can sometimes become a dangerous dead end. So, let me just ask you this. What do you think happens when air gets stuck deep inside your chest? And I don't mean in your lungs, I mean around your heart, around your windpipe. That's really the core question we're tackling today. And to get it, we first have to understand the location.
And that location has a name, the mediastinum. You can think of it as the central corridor of your upper body. It's the key piece of the puzzle we have to understand before we can see how things can go wrong.
So what exactly is it? Well, the mediastinum is basically the potential space right between your lungs. Now, that doesn't mean it's an empty box. It's more like a flexible, packed area, kind of like the body's main junction box. It's got your breastbone in the front, your spine in the back. It is the absolute core of your torso.
And this so-called space, it's anything but empty. I mean, it is jam-packed with the most critical stuff in your body. We're talking your heart, all the major blood vessels, your windpipe, your esophagus, and all of it is held together by this loose connective tissue, which, as you'll see, is a huge part of our story. And here's where it gets really interesting. That loose connective tissue, it creates these pathways, these invisible highways that scientists call fascial planes. This means the mediastinum isn't some sealed-off compartment. No, it's directly connected to your neck up top and to a space deep in your abdomen below. And this interconnectedness, that's exactly how air can get to places it absolutely should not be. Okay, so we've got the where down. Now let's dig into the what. What exactly is going on when air invades this central corridor? And that brings us right back to that big word, pneumomediastinum. Let's break it down. Pneumo, that means air. And mediastinum, well, we just learned all about that. So it's just air that has escaped from where it belongs, from the lungs or the trachea, and is now floating around freely in that central chest cavity. So how on earth does it get there?
Well, you'd be surprised. The routes that air can take are incredibly varied. We're going to start at the top, looking at some entry points from the head and neck, which, yeah, it feels a little counterintuitive.
Remember those invisible highways we talked about? Well, air can travel right down them. The source material points to things like infections in your head or neck, breaking a facial bone, or even some kind of trauma to your voice box, say during a medical procedure like intubation. All of these can literally force air down into the chest. But that's not even the most surprising one.
Get this. Believe it or not, even a dental procedure, especially one that uses a high-speed drill, can blast tiny bubbles of air into your tissue that then find their way down those fascial planes and boom, right into your mediastinum. It's a kind of startling, but perfect example of how connected everything is.
Okay, so air can come from the top down, but what about leaks from the inside out? Let's move a little deeper, because air can also escape from the structures running right through the mediastinum itself. We're talking about your lungs and your gut.
So, the most common culprit from the inside is definitely the lungs. A tiny little air sac, an alveolus, can just pop. This can happen for no reason at all, or because of pressure from a ventilator, or from a really powerful Valsalva maneuver, that straining you do when you cough really hard. It can even happen from barotta trauma, which is all about the pressure changes that happen when you're scuba diving.
Exactly. It's kind of wild to think about, right? A really bad coughing fit or coming up too fast while diving? Either one could create just enough pressure to cause a tiny leak, sending air right where it doesn't belong. It just goes to show you how much of a role simple pressure plays in all this.
And remember, it's not just the airway running through there. Your esophagus is right next door to your windpipe. So if your esophagus gets a hole in it, maybe from an injury or a bad infection, air from your digestive system can just as easily leak out into that same mediastinal space.
So we've got air coming down from the neck and we've got it leaking out from the inside. What's left? Well, the most obvious one, really, a direct route straight in from the outside.
And yeah, this category covers the stuff you'd probably expect. Serious chest trauma, of course, can create a pathway for air. But so can surgery. Procedures that open up the chests, like a sternotomy, or even creating an airway with a tracheostomy, can let air get directly into the mediastinum.
So let's just do a quick rundown. Air can travel down from the head and neck, maybe from something as simple as a dental procedure. It can leak out of the lungs from the pressure of a bad cough, or even scuba diving. It can escape from a tear in your esophagus, or it can get in directly from the outside through trauma or surgery. 4 totally different routes, all leading to the exact same problem.
And that really brings us to the main takeaway here. The very thing that makes the mediastinum this efficient central corridor for the body, its interconnectedness with everything from the neck to the abdomen, is also its greatest weakness. It creates all these potential backroads for something like air to travel and get stuck where it shouldn't be.
Which leaves us with one last kind of sobering thought to chew on. We've just seen how easily plain old air can travel along these internal highways. So the question is, if air can get through, what else can? It's a powerful reminder that the very design that makes our bodies work so well can also create some pretty serious vulnerabilities.
Hello and welcome. Today, we're going to take a tour of a part of your body you've probably never even thought about. But here's the thing, it's one of the most critical crossroads for your survival. We're talking about the mediastinum and what happens when uninvited guests decide to show up in this very, very crowded space. So let me just start with this question. What's really hiding between your lungs? I'll give you a hint. It's not just empty space. Not at all. It's a bustling, vital corridor just packed with essential structures. And, understanding this area is absolutely key to solving some of medicine's most complex puzzles. Okay, let's dive right in. First things first, we need to map out this area. The best way to think about it is like your body's central corridor, or maybe a major transit hub. Seriously, everything important has to pass through here. All right, so here's the more formal definition. The mediastinum is that space that sits between your 2 pleural cavities. Those are the sacs that hold your lungs. It's completely walled in. You've got your breastbone at the front, your spine at the back, the base of your neck up top, and your diaphragm down below. So think of it as this clearly defined but incredibly busy neighborhood. And what's just wild is how much is crammed into this one space. We're not talking about minor things here. We are talking about the absolute non-negotiables. Your heart and all the major blood vessels, your windpipe, your food pipe, all of these vital highways and pipelines are running through this one central corridor, all held together by some connective tissue. It is packed. Now, because the space is so crowded, any new growth, which we'll just call a mass, can cause some really big problems. So let's take a little tour of the most common types of these, let's call them uninvited guests. This table really shows one of the first and most important clues doctors use to figure out what's going on. Location, location, location. You see, the mediastinum is kind of split into 3 zones, the front or anterior, the middle, and the back or posterior. And the type of mass that shows up often depends on where it's found. For instance, up in the front, you're more likely to see things related to the thymus gland, like a thymoma, or maybe a thyroid goiter that's grown down from the neck. In the middle section, that's where a lot of lymph nodes live, so lymphomas are pretty common there. And the back section, well, that's where major nerves are. So that's where you'll typically find neurogenic or nerve-related growths. This geographical clue is a huge first step in narrowing down the possibilities from this really long list. So here's the crucial point. It's not just that there's a mass there. The real issue is that there's just no extra space. So what happens when these growths start pushing on their neighbors? Well, that leads us to something called mediastinal syndrome. Now, this isn't one single disease. It's really a collection of different symptoms that all come from the same root cause. Some kind of mass is compressing, trapping, or even invading the vital stuff that's packed into that central corridor. And it's really important to get this, that pressure can come from both cancerous, malignant, and non-cancerous causes. So on one side, you have cancers like lymphomas and thymomas. But on the other side, something like a really enlarged thyroid goiter or a big aortic aneurysm can cause the exact same compression problems. The effect is the same no matter what. Things are getting squeezed. This pressure creates a very specific set of signals, symptoms that act like clues for doctors. And here's the key. A pattern of what seem like totally unrelated symptoms can often point to a single localized problem right here in the mediastinum. So, let's look at how doctors actually read these signals to figure out what's being pushed on. First up, let's think about the two main tubes that run through here, your airway and your esophagus. What do you think happens when they get squeezed?
Well, if the pressure is on your trachea or bronchi, your windpipe, you might get this harsh, almost metallic-sounding cough that they call a brassy cough. You could also get wheezing or shortness of breath, and in really serious cases, it can even cause a lung to collapse. Now, if the esophagus is the one being compressed, the main symptom is dysphagia, which is just a medical term for having difficulty swallowing. See how each symptom points right to the structure that's in trouble?
But it's not just tubes running through the mediastinum. It's also packed with critical wiring, all sorts of nerves. So what happens when those get compressed? This is where the detective work gets incredibly specific. For example, pressure on the left recurrent laryngeal nerve can make your voice hoarse. If the sympathetic chain of nerves is affected, it can lead to something called Horner syndrome, which is a very specific group of symptoms on your face. And if the brachial plexus is involved, you might feel pain or weakness all the way down your arm. These are super precise clues that point to a very specific location of the problem. And finally, we get to the most critical structures of all, the great blood vessels. Pressure here, well, it can become very serious, very, very quickly. And this quote really drives home how high the stakes are. When a mass squeezes the superior vena cava, that's the major vein bringing blood from your upper body back to your heart, it causes something called SVC syndrome. And as it says right here, this is considered a medical emergency. Blood can't drain properly, and that leads to major swelling in the face and arms. It's a truly life-threatening situation. So, with all these potential causes and all these complex symptoms, how in the world do doctors figure out exactly what's going on inside that crowded space? How do they get a clearer picture? The path to a diagnosis is actually pretty logical and systematic. It almost always kicks off with medical imaging. A chest x-ray, or more likely these days, a CT or MRI scan. That gives them a detailed 3D view of the mass, its size, its location, everything. Step 2 is usually about getting a tissue sample. This can be done with endoscopy, where they use a camera to go down the airway, or even make a small incision to look directly into the mediastinum and take a biopsy. And that really brings us to our final thought here. The mediastinum is an incredibly crowded space with potentially life or death consequences. Diagnosing a mass here is just like solving a super complex puzzle, where every single clue, from a hoarse voice to trouble swallowing, is absolutely critical. It's just a fascinating example of how understanding the body's intricate geography is the key to saving lives. Thank you so much for joining this explainer.
Okay, so picture the busiest intersection in a massive city, right? All the essential supply lines, all the major highways, they all converge in this one central spot. Now, what happens if that intersection gets completely gridlocked? Well, today we're going to talk about a very similar situation, but one that happens right inside the human chest. We're diving deep into what happens when this critical space gets dangerously overcrowded, leading to a condition called mediastinal syndrome. So, first things first, what in the world is the mediastinum? Well, it's not actually an organ. Think of it more like a crucial compartment, a potential space that's tucked right there between your lungs. And this area is prime real estate. It's home to some of the most important structures in your entire body: your heart, the great vessels, your windpipe, the trachea, and your esophagus. It's basically the body's central transit hub. Everything has to pass through it. So that brings us to the big question, right? What happens when this incredibly important, super crowded space gets squeezed, when there's just no more room left to give? Well, that's where mediastinal syndrome comes in. Now, this isn't one single disease. It's really a collection of symptoms, a whole group of disorders that all come from the exact same root problem. Something is compressing or infiltrating or just plain trapping those critical structures that are packed so tightly in the mediastinum. At the end of the day, it's a syndrome that's all about pressure.
And this pressure can come from a couple of different places.
On one side, you've got malignant or cancerous conditions, things like lymphomas or other tumors. But the cause can also be totally non-malignant. For example, a really enlarged thyroid gland, what we call a goiter, could grow down into the chest, or a big dangerous bulge in the aorta, called an aneurysm, could start taking up way too much space.
But, of all the things that could possibly cause it, one stands out as the most common culprit by far. The number one reason for this dangerous pressure buildup is bronchogenic carcinoma, which in simpler terms is a type of lung cancer. It really just goes to show how critical that close relationship is between the lungs and this central space.
So all this pressure kicks off what you can think of as a cascade of symptoms. It's like a chain reaction, and the specific effect you see depends entirely on which structure is getting squeezed. It's not random at all. It actually creates this surprisingly logical, though, incredibly dangerous, set of clues that can tell doctors exactly what's going on.
And you can see here, it's a very direct cause and effect thing. You compromise the airway, you get dyspnea, which is just shortness of breath. You narrow the esophagus, you get dysphagia or trouble swallowing. You squeeze a very specific nerve, and suddenly your voice gets hoarse. It's all connected in a really logical way.
Let's dig into that a little. If we look at the airways, when the trachea or the bronchi get compressed, the first sign is almost always that shortness of breath. That can come with a really specific, harsh-sounding, brassy cough, or maybe a wheeze that you can only hear in one particular spot. And if that obstruction gets really bad, it can even lead to a collapsed lung or recurring pneumonia.
Okay, what about the nerves? The mediastinum is just crisscrossed with them. So for instance, if you put pressure on the nerve that loops up from the chest to the voice box, you get hoarseness. If a bundle of nerves called the sympathetic chain gets affected, you can see a really distinct set of symptoms on one side of the face, which is known as Horner syndrome. And if the brachial plexus, that's the nerve network for the arm, gets compressed, you can get pain and weakness that shoots all the way down into your hand.
And of course, the big blood vessels are right in the thick of it too. If you squeeze a major drainage vein like the azygos vein, other veins on the chest wall can start to swell up as blood tries to find a different way back to the heart. Pressure on the branches coming off the aorta can even make the pulse and blood pressure different in one arm compared to the other. But all of this, it's pointing toward the most critical complication of them all.
Because when that pressure hits one particular structure, the situation totally changes. It goes from being serious to being a genuine, time is of the essence medical emergency.
And that emergency is called superior vena cava syndrome, or SVC syndrome. This is what happens when the superior vena cava, that's the huge vein that returns all the blood from the entire upper part of your body back to the heart, gets severely compressed. The blood flow gets blocked, creating a dangerous backup, like a dam breaking. This isn't just another symptom, it's a full-blown medical emergency.
And the signs of SVZ syndrome are pretty dramatic. They're hard to miss. Because that blood flow is blocked, you'll see veins in the neck and chest start to bulge. Fluid builds up, causing really noticeable swelling or edema in the face and the arms. These signs are a huge, visible red flag that a critical circulatory highway has been completely shut down. So when you take a step back, mediastinal syndrome is just this powerful reminder of how a whole constellation of symptoms that seem unrelated, a cough, a hoarse voice, a swollen face, can all point back to one single overcrowded space. It really shows you just how intricate and delicate the body's balance is. And it leaves you with one final question. Where else can simple pressure reveal such complex truths about how we work?